bit of, oh, that's gone. Okay. Um, so with that, we will move on. So we're going to look at what is it, different types of question, and the main themes that come up. Um, so what is it? The UCAT is so the situational judgment part of the UCAT is the final section. It consists of 66 questions, and you have 22 minutes to do it in. So 26 minutes. I'm all over the place. This gives roughly 37 seconds per question, and it's designed to test your professional judgment. It will be a mix of clinical and non-clinical settings, and it's based on the governing principles for doctors and medical students. I myself am a medic, and so that's kind of the perspective I always approach it from. But absolutely, if we've got any dentists, it's really similar policy, it's really similar principles. So hopefully everything that's said will apply. It's the same exam, so it will be the same questions, the same ethical standards. But just if I'm talking through things in a slightly medical perspective, I appreciate that it will be the same for dentists. I don't know anything about vets, but if there's any vets that do the UCAT, it will also be the same for them. Although I imagine there wouldn't be. Um, so the scoring is separate to the rest of the exam, and that's really important. It is not going into your total. Instead, you get a total score and then a band for your situational judgment. Um, what will often happen is some unis disregard the SJT and they only care about your main score. Some unis will care about your score and your band. And some unis will kind of weight them differently. Some unis just have a cutoff of basically, if you get band 4, we're not interviewing you, but band 1, 2, 3 is fine. Some unis will cut off band 3. The only one I remember doing that when I was applying was Manchester. But it's really worth having a look at different unis and what they do. Because when it comes time to apply, you want to make sure that you know what they're doing with your UCAT score. Are they looking at your score in certain sections? Are they looking at your SJT band? And that can be really helpful for applying to the right places. I always think that the best medical schools to apply to are A, the ones you really want to go to, but also the ones that will interview you. Same for dentistry. It's really competitive at the moment. And actually, make sure that you're looking at the requirements that these places have, because I had a friend that tried to apply to a place that when he told me about it, I straight away just said to him, no, you can't apply there because they won't interview you. And he really wanted to go there, but he just had one thing in his portfolio that was below their minimum requirements, and it was a waste of an application. So you want to make sure that you're trying to apply to places that are the right fit for what you've got, and are going to be likely to interview you. Band 1 to 4, and partial marks. This is the other thing. So a lot of the questions can be a little bit subjective. So what they often do, and I think this is the process they go through, is they have a room of professionals that have a go. And if the professionals all went, yeah, that's the right answer, then that will be what's given the marks. But a lot of the questions, if they have 60% of the professionals go for one answer, and 40% go for the other, they'll take the one that everyone went for and give that as full marks, but they might well give the other one as partial marks. So not getting it 100% right is going to be okay on quite a few of the questions. We don't have a great insight into how they do this. So it means that when you're doing situational judgment practice on some of the different question banks, not all of them have a perfect version of partial marks. Some just don't give it at all. Some do half marks. I'm not 100% sure how they do this, and I think some of the question banks get it wrong. So it can be worth being aware of that maybe your real situational judgment can change ever so slightly depending on how the question bank you practice with does partial marks. In terms of question types, there's three main ones. So we've got our how appropriate questions. How appropriate are each of the following responses by whoever you are in the question in this situation? Those you're going to tend to have four options of very appropriate, appropriate but not ideal, inappropriate but not awful, and very inappropriate. Then we have most least appropriate. These are new to me because when I did the UCAT, these weren't on the exam. So you choose the most appropriate and the least appropriate action that the person could take in response to the situation. Then we've got importance questions. So you'll be given an ethical scenario and you've got to say how important different factors are in considering what you're going to do. These are the main question types. We're going to focus mostly on the first two just because we don't have time to go through everything. But yeah, that's what we're going to discuss. Also, it's worth saying I know some of you may already know about some of this stuff. So I know everyone will be in different stages of prep. Some people might have started, some people might be waiting to the summer to start, some people might be getting started soon. So hopefully, even if you already know some of this stuff later in the session will be of value. I'll try not to labor it too much, but we'll just try and make sure that everyone understands everything. Also, I'm going to keep an eye on the chat, so just put your questions in there. We have our first one. Would the score on question banks tend to be higher or lower without partial marks? It depends on how they do it, because if they don't award partial marks at all, you tend to get a lower score on the question bank than in the real thing. If they do award partial marks and maybe they award them too generously, maybe that would mean that you get a higher score on that question bank than you should. I think it's more likely to be the second scenario. Sorry, the first scenario where they're not awarding partial marks. I think that's what more question banks do. But it's worth being aware of the fact that not all question banks get it exactly right in terms of how partial marks are awarded. So I can't say exactly because I don't know how they do it. I don't know how the real UCAT does it. But I think more often than not, you'd get a lower score out of a lack of partial marks. Okay, so our reading list. These are our ideas of what we think you guys should have a look at beforehand. It's worth saying they don't require you to have a knowledge of medicine, but these things are going to really help you because while they say they don't require it, they kind of require a bit. This is the best one. Good medical practice by the GMC. GDC standards for the dental team is also brilliant. The main reason I recommend good medical practice is because more of the questions are focused on a medical setting. Just because I think more medics take the UCAT than dentists. So good medical practice is going to be great to read. However, if you're a dentist and you're going, I want to read the GDC standards instead, you probably would get just as much out of it. But good medical practice is a really great thing to read. I can put a link to it in the chat at the end of the session if people want me to, but if you type that into Google, you will find it. It's a really great document because it just covers loads of stuff about different areas of medicine, what our standards are, what professional standards are. Now, you're not going to read it and instantly have the answers to everything, but I think it gives you a really good insight into the kinds of things we worry about in terms of professional good medicine, and the same for dentistry. It gives you an idea of what are our concerns, what are the things that we're looking at. These issues are going to be the issues that come up in the situational judgment. And I think reading these texts gives you a better understanding of what these issues are. And it allows you to be a bit more thoughtful in terms of picking out different aspects of the question. That's why I think these things are worth reading. Outcomes for graduates is really helpful. So that is the GMC, the General Medical Council, who regulate doctors. They put a document of what they expect graduates from medicine to be able to do and what they expect from them. And that's, again, really helpful to see the standards that doctors are held to. I'm not aware of a similar document in dentistry, but I'm sure there will be one out there. Doctors' use of social media content by the GMC. We can talk a bit more about this later. I wouldn't say that's the single most important one because social media is only going to come up in a certain number of questions, but it might come up every now and again and it's worth having a think about. However, I would say you could get away with just reading good medical practice or good dental care standards because those things will kind of cover social media to an extent. So don't worry too much about reading that one, but it can be a good one. It's also a common interview topic. And that's the other side of this, is that all of these things are great to read in advance of your interviews. So actually, if you're going to have to read them at some point in the next year, might as well read them before the UCAT so that you have that familiarity for the UCAT and for your interviews. Because especially good medical practice, but also doctors' use of social media is going to be really helpful for medical interviews, and GDC standards is going to be huge for dental interviews. So have a look at these if you fancy it. Logistics and strategy. So this is kind of more the bulky part of it. Worth saying as well, if anyone's got any questions about anything so far, just feel free to put them in the chat and I'll try and keep an eye on the chat as we go along. So every question is independent of the previous question. That's really important. So if you have a response that you're doing, it's independent of the previous response. It's not assuming you've done that. It's not assuming you're going to do that too. It's assuming this is your primary response. You have to think about what the General Medical Council would want you to do. It's a bit like, I don't know if anyone was ever a prefect, but in prefect interviews, so I applied to be a prefect at my school. And in the prefect interview, they had a question of what would you do if you saw your friend on their phone in the corridor? And obviously everyone's in their head going, well, nothing, because they're my friend and it's fine. But you have to explain it as they would want you to. You're going, oh, wow, I'd advise them to stop. And if they didn't stop, oh, well, maybe I'd tell them what the consequences would be. And, you're doing these things a little bit for show. So make sure you've got that mindset of what would a medical council want me to do? What would unis want to see me doing? There is always a right answer. So there's always one that they think is the best option. But because there's partial marks, it's not always as important to make sure you're on the right answer. Obviously, you're trying to do it as much as you can, but there is always going to be something that they've agreed on as right. And sometimes you will get questions where you don't feel like any of the options are great. You just go with the best of what's available. The last thing is not every scenario will be in a medical setting. So this is something that's really important for people to understand for interviews, but is also a great thing to understand for the UCAT, is that professionalism doesn't just extend to your life within medicine or dentistry. It also extends to the stuff you do at home. So quite a lot of the questions may be personal situations or situations while you're studying at medical or dental school. And these situations, it's just as important to stick to the General Medical Council prescribed guidance and to stick to your professional values. But just because it's not in a medical setting doesn't mean that your responsibility is reduced. Okay, general strategy. First things first is read the scenario thoroughly. It sounds really basic. All your teachers will have told you that before any exams, but make sure you're reading them in detail. I think the SJT is quite a nice section because, as we discussed, it's a lot of questions. So I think, yes, 69 in 26 minutes. And it feels like that's a lot. But if anyone's done a situational judgment practice, I think they may well agree that it's not that bad. And especially compared to the rest of your UCAT, where time is going to be really tight, it's actually pretty relaxed. So take your time, have a really good read of the question, make sure you understand what's going on. Identify key issues and themes. So this is where reading good medical practice, good dental care is going to be a really important thing, because you might have a question where the issue is confidentiality or patient safety or something along those lines. It's really good that you can actually identify that to yourself and say, okay, this is what they're asking me about. Because when you're judging responses, you're looking at, are they dealing with the key issues? Are they dealing with the key theme in the question? And sometimes you'll see responses that, while they might be appropriate, they're not dealing with the key issue or the key theme, and therefore they're not the most appropriate, or they might even be inappropriate. If you have certain situations, for example, when patient safety is a concern, we always say that patient safety is the most important thing. So you might have a response that feels appropriate, but doesn't deal with patient safety. That would actually be an inappropriate response because you've not dealt with the main thing. So being able to identify those issues and themes is a really helpful thing. Thirdly, identify the role of the character. So you are going to get a whole range, and we're going to go through these roles in a second, but there's a range of roles they can ask you to take. And look at the specific question you're being asked. All of this stuff is just saying, be really thorough, be calm, you've got time. The SJT is a reasonably relaxed section, so make sure you're giving it an appropriate amount of time. I also think it's better with the situational judgment test, and this was for me, so obviously it might not be the same for you. But I found that if I went back through and changed answers, I was overthinking and I was changing answers too much. And actually, I was better off taking more time and going through questions thoroughly and then not checking, or checking only once, or flagging questions I wasn't sure on and only checking them, but doing something to avoid what I think a lot of people get tempted into of, right, I've got the time, I'm going to go back and review every question. And I think sometimes you do overthink it a bit. So be thorough the first time so that you're not having to go back and kind of doubt yourself and overthink. I think that can be a helpful way of scoring it. I would try both ways in your practice. So try doing sections where you don't review, or review once, and try doing sections where you review a few times and just see what feels more comfortable, see what's getting you better scores. Because I think it's quite a personal decision, but that's something to be aware of when you're deciding how to approach it. So different roles. There's loads. So you can be a student, you can be a junior, and you can be a consultant or a dentist. Medical student. So you can perform basic clinical skills. You can take a history from a patient and you can see patient records. You can't prescribe, You can't make decisions regarding patient care. You can't act beyond your limits. So you cannot be in charge of any decision making, and you cannot prescribe. Now, these are things that medical students do. Medical students are allowed to do some of these things with close supervision. So we in my GP practice in third year, we're offered an opportunity to prescribe. If we think that there's a medication that's right for what's going on with the patient in front of us, we're allowed to venture that prescription. While we can't sign off a prescription, we can't send it in, we're not qualified to do that. We can have a go at what is the prescription that we need to give, and the doctor orders it for us. So a lot of these things are a little bit grey when you get into medical school of what they'll let you do. But in the UCAT, it's just a blanket. You can't do it. You're regulated by the GMC. That's the governance you're under. So everything medical students do has to be according to GMC guidance. People are really good at knowing that junior doctors and consultants and doctors are regulated, but students are regulated too. Junior doctors. So you can make decisions regarding patient care, and you can complete appropriate steps to do so. So that might be taking a history, that might be examining, that might be interpreting imaging. But you can't make extremely complex decisions. So if, for example, two consultants are disagreeing on what should be done in a situation, you aren't qualified to be the one that decides which plan to go with. So these more complex decisions that maybe are above your capacity, you can't do. Again, you must work within your competency, and you're under the governance of the GMC. When we say working within your competency, everyone is governed by their own competency. So that's things like, if I'm offered to do a surgery that I have no idea how to do, and I'm not qualified to do, I shouldn't do it. If I'm offered to do a procedure even, and I'm not sure how to do it, I don't know what I'm doing, I'm not supposed to do it. You have to be aware of the limits of what you can do well. And if you can't do something, you can't do it. Sometimes they'll push that with ethical scenarios where maybe you're the only person who can do it. But I think it's important to always be thinking about, am I causing harm in this situation, or am I providing benefit? And sometimes you have to take smaller risks, but they're never going to make you take big risks of, you're the only person that can do the surgery, but you have no idea how to do it. You shouldn't do it, because you're always going to make things worse if you're doing things really blindly like that. Consultants. So you can make the complicated decisions regarding patient care, and you have the highest level of responsibility. You can't break or bend rules. Now, consultants in real life do this a little bit, because they're cheeky, and they are sometimes a little bit arrogant, because they know that they're quite valuable to the hospital. So some consultants will be a little bit funny, but in the UCAT, you can't do anything. You are again governed by the GMC. Everyone's governed. Dental students, this is really worth paying attention to for medics, because I think sometimes medics forget that you can be a dentist, and you're going to be less of them. There's always less dentistry questions, but it's worth knowing that dental students can perform basic clinical procedures under supervision, and they can prescribe with supervision. I would say that medical students can do those things too in real life, but in the UCAT, they can't. You cannot treat patients without a treatment plan. So you need to make sure that whatever is being done in a question by a dental student, it should be under a prescribed plan. Otherwise, you can't do it. They're normally pretty clear at spelling out if it's under a prescribed plan or not. If they haven't said anything about it, you probably assume that it is. You're governed by the General Dental Council, and then dentists. You can perform all relevant clinical procedures independently. You can't perform specialist procedures unless you're trained to do so. Again, that's just another way of saying act within your competency, and you're also governed. Okay. Any questions about any of that so far? No? Okay, brilliant. So we'll go and have a look at some appropriateness questions. So there's two types that they can give you, and we've discussed this a little bit earlier. So we've got our how appropriate are each of the following responses, and then we've got choose the most appropriate and the least appropriate. I'd say type 2 is a bit easier. I'll show you some example questions in a second. We're going to have a go at them. But I would say type 2 is generally a little bit easier, just because you have a bit of an easier time, because you're not rating how appropriate things are. which is maybe a bit harder because there's a bit of subjectiveness. It depends on information maybe that they haven't given you. Whereas type 2, you have a really good ability to compare and you can say, okay, well, is it better or worse than that one? And even if you're not sure how appropriate something is, you know if it's better or worse than the one before. So, our tips: never assume anything that's not stated in the question. Um, Look at the specific question, pay attention to your timing, and only think about options listed. Now, paying attention to timing is important because while I say a lot about how relaxed this section is, you don't want to spend so long on one question that then you're rushing at the end through the last 10. And while I maybe find this section not so bad for timing, there will be some people who do. It's a lot of reading, it's a lot of thinking about what to do in situations, and it can be quite complex at times. So if you are someone for whom the timing is a struggle, make sure you're just paying attention to how long you've got left and you're just keeping an eye on it. So this is our first practice question. Now, the things I would recommend doing on a question like this. So firstly, thinking about what are the most important themes. What themes do people, I'll give you some time to read it, and then I'm going to ask you guys about what themes you think are a part of it. So I'll give you guys maybe a minute to read it, and then we'll discuss this question. Okay, yeah. And when people are finished reading, just start putting in what do you think of the themes we're being asked about in this? Okay, I'll start having a look at what people are saying. So patient consent, yeah, absolutely. Patient consent is a really big thing in this. We can see that a patient's consented once. We're now thinking about, okay, is that consent still valid? Beneficence, absolutely. Am I doing good for this patient? And what's the best I can do? Because actually, this is a situation that happens. I take blood quite a bit. I've started working as a phlebotomist. I'm terrified of this happening. I've nearly done it once, and I got it halfway into my sharp spin, and then realised and took it back. And the problem is a sharp spin because it's full of needles. You can't really stick a hand in and get it back out. Um, it's a really scary situation, but it's one that I think will happen to everyone that takes a lot of blood. So yeah, what can I do that's good for this person, and what can I do that's good for this person once the situation isn't amazing? I think that's a really important thing to think about. Patient safety and well-being, absolutely. So is it still safe to proceed? And if my patient's looking really nervous, if my patient's quite distressed, I want to think about managing that. Obviously, as medical students and dental students, you want to get as hands-on as possible and you want to do as much stuff as possible. But you have to always do that in a manner that encourages your patients to feel important and safe and good. The patient is more important than your learning. So in a situation like this, it is worth thinking about, okay, if my patient's well-being is suffering, maybe I need to think about that when I decide how I'm going to respond to the situation. Really good, guys. So you've spotted quite a few of the themes that I think this is covering. What's our role? Medical student, absolutely. Um, and one of the things you can think about as well, you can. So I'm going to show you on the next slide an answer option, and get you guys to do a poll to say what you think of the option. But even before you go and look at that next slide that's going to have your answer option, you can have a think about what to do in this situation. Now, I really like it as a way of going through questions. It's worth saying that obviously there'll be some questions that are so far out of what you know about or quite hard to imagine. So it can be quite difficult to think of what I do in this situation. You know, if you've got something complex to do with patient care, that might be quite difficult. But I think most of us can put ourselves in this situation and think, right, what would I do now? Um, and just put some things in the chat of what you think you would do in this situation. Yeah, so Ronak said ask for consent. Absolutely. I think in this situation, if I wanted to take blood again, I do want to ask for consent again because maybe the patient has changed their mind. Mariam, maybe explain the situation to the patient and why it's important a blood sample be taken. Yeah, absolutely. It's worth saying that obviously, if this patient has already agreed to have blood taken, they probably are okay with it. So it's maybe not so important to explain why they need the sample, but absolutely explain what's going on. Um, Onyinye, explain to Kara everything that's happened and then ask for consent again. Yeah, absolutely. Trinity said very similar. Explain to Kara the situation that's happened. Isabella, apologize, ask for further consent, and ask if she wants someone more qualified. Yeah, I think that's a really nice thing to do. Mariam said if the patient is uncomfortable with the medical student doing it, maybe alert a consultant or junior. Yeah, absolutely. So all of these things are really good things to do in this situation. And that's a really helpful thing to think about because now when you are given answer options, you're not just going, okay, do I think this answer option is appropriate or inappropriate? If so, how appropriate, how inappropriate? I'm almost thinking, okay, I've got some ideal responses in my head of, what are the really good things I could be doing right now. Um, so I know that something's very appropriate if it really lines up with those kind of things. I know something's appropriate if it kind of does those things. And I know something might be inappropriate if it's nowhere near those things. And you can see how that can actually be quite a helpful way of approaching a question. So I hope that's helped you guys a little bit. So here's our answer. Ask Cara if she would like for someone else to take her blood. I'm going to put a poll up and everyone can answer if I can figure out how to do polls. Sorry, I haven't used Zoom anywhere near as much recently. So I'm still really relying on an old memory of how to do it well. Okay, so we've got a real split on answers. Um, okay, so I'll ask some people to unmute and explain what they're thinking. So if anyone that puts C puts a thumbs up and I'll ask you to unmute and explain. No? Okay. I'll just say if anyone wants to unmute and explain their answer, just put a hand up and I'll ask you to explain. I'm not seeing any hands up. It might be that I'm just missing it. So feel free to put it in the chat if you do fancy unmuting and explaining. But obviously, I'm not going to force anyone to unmute and explain it. So I can just discuss it with you guys. No, okay. So does anyone want to put in the chat what they think in terms of why they've gone for the answer they've gone for? I think it's really helpful to get an idea of what people are thinking with these questions and where different people take it. Because it's always really interesting to think about. And sometimes people will come up with something where you kind of go, oh, I wouldn't have thought of that. So yeah, if people just put a little bit of an explanation of why they've gone for what they've gone for. Okay, so Mariam said it's an appropriate thing to do, maybe not the first thing to do, as you could try and manage the situation yourself first. Yes, you could try and manage the situation yourself first, as in try and take the blood again. Um, Although obviously that deals with our first thing of yes, we need to get this procedure done. But I think in the back of my mind, I'm also thinking, right, I need to make sure I'm managing this patient's well-being. And it might be that in this situation, especially given the practice says the question says I'm practicing taking blood, that does imply that maybe I'm not the most experienced at it. And actually, maybe it's better for the patient if I just go and get someone. Naomi went for A, unsure. because it doesn't specify whether Kara gave an explanation for why. Yeah, so definitely we need to make sure that Kara is given an explanation for why, and that's part of our ideal response. Now, it's worth saying that a lot of the time you're not assuming that what you do is the only thing you do. It can be a bit funny though, they can be inconsistent with that, but I wouldn't say that that holds this back from being very appropriate. Near, because it's said that Kara is afraid of needles and nervous, so it's very appropriate to ask her. Yeah, I would agree. So I think this situation has happened to me with people that aren't needle phobic. And each time I'll explain why it's gone wrong. Not binning the blood, but not being able to take blood the first time. And I'll explain what's happened and ask if they're okay with me trying again. And those people are fine with it. But if someone's really afraid and very nervous and it's a lot of work, I'm much more likely to quickly go and get someone else because actually you're someone for whom each further attempt is going to make things worse and going to make you more afraid, and you're not going to want to come back next time. So I meet a lot of people who are afraid of having blood tests or afraid of coming into hospital because they have these bad experiences. So we're always thinking about that kind of thing. A, because the patient well-being is most important. Having someone more qualified may make them more comfortable. Yeah, that's a really good point. So even if they're not necessarily better at taking the blood, it might just be enough to make them feel a bit better about it. B, because Kara is nervous and so could potentially make a more severe mistake, but not ideal as patient would need to get comfortable again with a different person. Yes, that's absolutely something to consider is would they get comfortable again with a different person? And also, yeah, if Kara's nervous, maybe a mistake could be made. It can be a bit harder when people are nervous because they might be a bit more jittery and move a bit. Do you assume the suggested response is the first thing they do? Yeah, kind of. Um, yeah. So you're assuming that it's the first thing you do. But you're also in this situation. And I would say this is why practice is really important because you do get a bit of a flavor for what they consider. But I would say that in this situation, this does not tell me that she hasn't explained it. Um, I think in this situation, this is a very appropriate thing to do. I'll check afterwards to make sure that that's the answer. I think I've got it on my notes somewhere. Um, but yeah, I would assume this is very appropriate because even though it doesn't explicitly say I've explained, this is part of a very appropriate response. If I explained as well, that's my whole perfect response. So yeah, you're kind of assuming that even if you're assuming it's the first thing you do, but also you're not assuming that maybe that action hasn't been taken. I know it's a bit wishy-washy, and I feel bad that I can't give you a really clear cut, yes, it's absolutely the first thing you do, or it's the only thing you do, because I think I've just found that with doing it myself, they can be a bit inconsistent with it. It's not always super clear, but to me, this question, it's not telling me, okay, they haven't explained it. Um, I think they would be more clear with that if you hadn't done that. Okay, yeah, so that was the answer on that one. Now, here's another action. So for this one, it's going to be a most appropriate and least appropriate. Um, And what I'm going to get you guys to do, because I don't have a poll for this one, is send a message in the chat with your answer of most appropriate, then least appropriate. But send it to me directly on the Medicat account rather than sending it to everyone so that everyone kind of gets a chance to answer. And if you want to explain, feel free to explain. Yeah, okay, so everyone is doing very well on this one. Um, yeah, everyone's got it right. So you guys are absolutely right. All the explanations have been on point as well. Um, Obviously, ideally, you know, apologizing to Kara, great. That's dealing with it. And people really appreciate things like that because you're being direct, you're being honest. It's showing they can trust you. Because if you didn't tell me what was going on, I wouldn't trust you next time because I don't think you're giving me all the information. Then some people have put a medium option and it's C, asking your supervisor to explain the situation to Kara. Yeah, so you're doing okay because the situation's been explained, but you're not doing great because you should be having that conversation. Um, It's really important as well to have these negative conversations, because not everything goes well, not everything happens perfectly. Um, Being able to manage a difficult conversation like this is a really important skill. And actually asking the supervisor to do it is not great because you aren't building that skill. And the patient's not going to trust you as well. And then everyone has been really good at going for the least appropriate option. Someone's just corrected theirs because they got it the wrong way around. Tell Cara that a co-worker lost the blood sample. This is clearly lying and will break the trust completely. It's also just a horrible thing to do. So yeah, that is the worst option. Really good. I hope you guys can see as well why I think these ones are slightly easier, because I do think there's just a little bit. I think they're just that little bit easier. Um, oh, what's happened there? Oh dear. Okay, my computer's gone a bit funny, and it's back. Okay, cool. So the next thing we can do. I kind of need to be done with this by about 6:10 because I've got my brother's doing a concert at school that I'm very excited to go and see. So we have three things left to cover. The first thing is how to practice, and I really want to make sure we get through that. The second thing is we have a couple more example questions, and the third thing is question and answer. Um, so I'm just trying to think about how to make sure we get everything out of it. Maybe if we do one more set of questions, then we'll do how to practice and then Q&A, and then hopefully that gives enough time to answer all questions. I just really want to make sure we have enough time on how to practice because I think it's a good thing to discuss with you guys. And if anyone is feeling like they know most of what we've discussed already, maybe that will be the bit that's really helpful for them. So everyone have a read of this one, and we'll keep going. Um, Ikelin's asked which one is the best option again. So for that one, the best option was B. It was explaining the situation yourself. So yeah, have a read of this one, and then I'll give you guys some questions. Okay, so hopefully everyone's had a chance to read that. What I'll do is I'll give you guys the sample response, and then I'll kind of flick back because I think that might make it a little bit easier. So here's the poll, um, and our sample response is request to be moved to a different ward. What I'll do is I'll put that in the chat, and then I'll go back to the question. Okay, so people are doing pretty much exactly what I think should happen with a question like this. So we've got a range of answers from A to B to C. And I can completely see why I think you can argue any of those. So does anyone want to unmute and explain this one? No, okay. So for this one, we've got some people going for A, most people going for B, and then some people going for C. B is the correct answer. The reasoning is that while we've got this situation that's really negative, requesting to move to a different ward will get this person out of it. It doesn't solve the situation necessarily because, okay, that's great for our medical student, Rachel, that she's moved on and things are fine for her. But the problem is that these people are still going to be exhibiting that behavior. And, you know, what if a new medical student comes and joins the ward on the next rotation and it's another female medical student? They're going to get the same poor treatment. So you haven't dealt with what these people are doing. So that's why it's B, because it's appropriate, because you are removing the situation from happening and it's solving half the problem. It's solving the problem for Rachel, but it's not ideal because it doesn't solve the whole problem. Now, I can completely see why people would argue that this is very appropriate. because I can see that actually in a situation like this where it's sexist discrimination, you just want to leave it behind. I can see why people are going for that. I can also absolutely see why people are saying C, because you could argue that actually it's pretty harmful not dealing with this, and it's creating a bad work environment. So I think both those options are definitely very reasonable, but I think B kind of captures it best as, yeah, it solves part of the problem that's going on, but it doesn't solve all of it. And it's worth saying that you guys will get the feel for that as you go along. The more practice you do, the more you'll get a feel for, okay, is this covering enough of the problem to be A? Maybe this isn't covering all of the problem, but is it covering enough not to be inappropriate? You know, it's a sense that builds over a long period of practice rather than something that straight away comes to you. Um, and our second response, this one. So I'll relaunch the poll. And can people send explanations for what they're going for in the chat on this one? Can't see any options. Okay. Do you want to just send me directly what you're going for on this one? If you can't see the poll, just send me your answer. Okay, yeah, so people are generally getting this one. I think I did give the game away a little bit on the last one. Do people want to put some explanations in quickly? So I'm saying B, it might help resolve the situation, but their pattern of behavior means that they might not be receptive. Yeah, that is definitely a consideration. Trinity, I think that A is important. Oh, someone's discovered how to draw on these slides. Oh, I enjoy. A, as communication is really important in order to provide the most quality of care. Yes, you're using your communication skills. Now, that's something that you can get a bit of a feeling for is, if you're using a communication skills, they really like that because that's a really positive thing. So yeah, those kinds of things are always going to bump things up. A/B, I think it's important to discuss the matters that can help be prevented in the future. Yeah, absolutely. So it's definitely appropriate because it's dealing with the problem. It's then kind of deciding which of A or B do you think it is. A, because you're trying to solve the problem directly and addressing with those involved before taking to a higher up. Yeah, absolutely. So this is an important principle in situational judgment. They want you to escalate where appropriate, but they don't want you to escalate all the time. So actually, in this situation, if you can talk directly to the people and probably resolve the situation, that's good. That means that great things are going to work. It's in part because of kind of how busy and how complex the NHS is that you want problems not to be drawn out and involving loads of people. You want to try and solve them at the lowest level possible. So if Rachel discussed the matter with Michael and Alfred, and they apologized and started behaving better, actually, we've dealt with it. Fine. We never needed to get anyone else involved. Solved it. Obviously, as people have said, people might not be receptive to that. A lot of people, especially people showing repeated behavior, will not be as receptive as they would be ideally. But just in this situation, we don't know that they're not receptive. That's an assumption that we're making. So we assume that they might be receptive. So it's definitely a really appropriate thing to do. Um, if they aren't receptive, then maybe we take it to a higher up, and that could be a really good thing to do. But the first line is going to be, let's think about having that conversation. Um, someone said they were drawing by mistake. Appropriate because it might resolve both problems. Yeah, absolutely. Yeah, so people are really getting this. Wouldn't it also be possibly unsafe in case the conversation escalates? So that's a really good point. Now, I think that's the difference between what we're talking about and maybe other things in this domain, because this is not harassment, this is not abuse, this is discrimination, and they're quite different. So this is just they're excluding her from meetings, I think, in the question, and they're correcting her. They're pointing out mistakes in front of patients and things like that. Now, these things are bad, and definitely, you wouldn't wish them on anyone. These are not nice things for people to be doing to you. But that conversation is much less likely to escalate than a conversation where maybe it's harassment or abuse of some kind. Those conversations are where we might be much more saying, actually, maybe escalating is the first thing you do. That might be a much better idea. So you can see that there's kind of, it's going to be a bit nuanced, but I think looking at the situation, you can get an idea of, is escalation appropriate? So I think that's a really good point to make and a really important thing to consider. But in this situation, I think you're appropriate to have that conversation. It's worth saying as well, the rest of this question, we've only got these two options for it. But the rest of this question also covers escalating to the other staff member, Rosie, the female consultant. And that's also given as very appropriate because, again, it deals with the problem that's going on. So there's more than one ways to skin a cat. You can do this in multiple ways. For this one, the answer is A. And for that one, the answer is A as well. They both are very appropriate responses because both of them are dealing with the situation well. Okay, any questions? If not, we're going to move to our how to practice section. Cool. So those are my other questions for if we had time, but I think we've hopefully got enough sample questions in there that you guys are a bit more comfortable with them now. So, how to prepare for the situational judgment test? I would try and rub that off, but I have no idea how to. So, hopefully, it's fine for us to continue with that little bit of pen on the screen. So, my ideas on how to practice. Because what I normally do, I've done a few of these kind of webinar things before. I sometimes do teaching in our masterclass and things like that. I cover stuff with students as well. And almost always, these are the things that people are asking about in the Q&As, is how do you prepare? So I think to structure it, this is what I would do. And obviously, you can tailor this to yourself individually. Now, some people will start now. Some people will have already started. Some people will start in the summer. All those things work. Just make sure you give yourself enough time. We as a company recommend 6 weeks minimum, but you can start earlier. I prepared in 4 weeks, but I was doing it during the pandemic. There was a lot less going on. I was having quite a good routine of I had lots of time available. You're going to be busier than me during 2020. So I would recommend giving yourself more time than I had. But give yourself the time. And I think then there's a process you go through. So the first process, and it's a bit like what we've done today, is slow practice. And you're getting that thought process down. Can I pick out the role and the important themes? Can I think about the positives and negatives of each suggestion? Can I start thinking about what I would do in these situations? That's the first thing that you're trying to get down. We as a company offer a lot of things to do with this. So we have our masterclass. It's a weekend masterclass, and it takes you through all 5 sections in more detail. So, we'd cover the other question types, and there'll be more strategy, more tips and tricks. So the masterclass can be a really good place to start for getting that stuff down. We also have our tuition where you can have one-to-one sessions with a tutor. So I do quite a bit of tuition, especially in the summers. I do a lot of UCAT, and then I do lots of interview stuff in the winter, which I think is really fun. And there we kind of analyze where things are going wrong and incorrect questions. We can discuss topics with you that come up in SJT to try and kind of boost your understanding of them. So those are the options that we do. We also have our ebook that I think is really brilliant. It's like I think it's written by top 1% scorers, and it's just loads of strategies for different question types. The idea is with all of this stuff is that what you're trying to learn is how do I approach this question when it's in front of me? Because I think the hardest thing in the UCAT when you first start is you're given so many different questions, so many different types, and you have to work out how to get to an answer on all of them. And actually, just by having these strategies and these processes in place, it means that you are that much more prepared that when you see a question, you immediately know what you're doing. That applies a lot for the other sections. For the situational judgment, I think it's thinking about that thought process. So I really like if someone's struggling with situational judgment to just go through questions slowly and discuss them with them. And eventually people get to a point where they're having that thoughtful discussion, and I'm almost saying nothing. That's perfect because that tells me, okay, you're at a point where now you can fully think through these questions really well. So that's a really important thing. If you're interested in any of those options as well, just get in touch with the Medic Cut team, and they'll sort you out because they deal with all of that stuff. You can request tutors, so you can kind of pick what's right for you. And we do medicine, dentistry stuff. We do UCAT, personal statement, interview. So those resources are really good and available to you if you want to use them. We then also say about speeding up. So this is kind of the second step of your prep. And that's going from, okay, I can do these questions in principle. I can do the theory. I could do these questions slowly. Can I speed that up to match the timing of the test? Um, in this section, it's gonna be a little bit trickier in the other sections than this because situational judgment, the time pressure is not quite as bad. Um, During this bit as well, I think it's really important to discuss how to analyze because you're going to be doing lots of sets of practice questions. So, in terms of practicing, I think it's great to do practice questions. Do them on a computer, not out of a book. That's how your real exam's going to be. But do practice sections and try and do them in the time that you would be given in the test and in the proportion you would be given. So, it's a pet peeve of mine is I don't like people doing a uh, oh, I'll do 20 situational judgment questions. I kind of say you should do the full amount that's in the section or half the amount in half the time, but try and make that proportional. And then that's a really great thing to do. You'll learn so much out of doing those practice sections. You'll get more and more comfortable with them. But the other really important thing to do is once you've done that practice, analyze it and analyze it soon after you've done it. Don't leave it for the next day. Do it that day. I would rather someone does 2 hours of practice and an hour and a half of analysis than 4 hours of practice every single time. Also, you don't have to hit those numbers regularly. Like, make it work for you. But that's a really important part. And when we're analyzing, we're going back through and we're looking at the questions we got right and confirming why we got them right so that we'll get them right again next time. We're looking at the questions we got wrong, think about where did we go wrong? Is there something I didn't consider? Did I not stick to my process? Did I run out of time? Why did I get this wrong? And what maybe could I tweak next time? Do I need to be more time conscious? Do I need to make sure I'm doing this every time I see a question like this? Um, and then you're also looking for patterns. Am I always getting them wrong when they've got confidentiality? Maybe I need to go and read about confidentiality. Those patterns are super, super important because that will teach you what things are you getting wrong more consistently. If you can work those things out, you can go and remedy them. I do it a lot as a tutor, as people will come to me and say, I'm finding this question type hard. And that's a really great thing we can do. So sometimes I'll have a student that books 1 or 2 sessions and there's these 2 question types I'm finding really hard. I need to go through them. Can you teach me them? That's a really helpful way of doing it because you found your weakness and we're going to fix it. So those kind of things I think are really good to do. And those patterns are super important. I would keep notes on what you do. I had a little black notebook where I would write every day what I was doing for practice. I would write how I scored. I would write what was going well, what was going wrong. It's a bit like school, you do like what went well, even better if, is those kind of things. And you're just trying to keep those notes so that you know what you've been doing. You have an idea of what you've been practicing. Um, and then the last thing is more when you're getting close to your actual test date is you want to be moving to doing more and more full papers because the situational judgment is at the end of your UCAT. You're going to be tired when you do it. So doing it fresh is going to be different to doing it after sitting an hour and a half of the rest of the sections. So make sure that that's something you're experienced in. Personally, what I used to do, and I found this really nice, is I would do a full exam and I would sit there and do all of it. And I was really in the zone, I was focused. And then, you know how you have a minute between each section? I would between quantitative, no, it's abstract last. I would do between abstract and situational judgment. I put some headphones in and put some music on. And I'd do my situational judgment in the time, and I'd be listening to music on a reasonably low volume so that I could still focus. That was really helpful for me because I think it just made it that, okay, I can chill, I can do this. It's kind of a reward. It was a good way of practicing. So I found that really helpful for me. But yeah, make sure you're practicing with full papers and doing it at the end of the paper. Those are my ideas on how to practice. That's what I think people find helpful. So if any of our resources would be helpful to you, feel free to reach out. Some people just want loads of tuition to go through loads of different things, and some people get a lot of benefit out of that. Some people want little bits here and there. The masterclass, I think, is a really good option. So I would recommend that to people. But also you can practice on your own. You can do it without. It's up to you how you want to approach it. But be aware of those options being there for you and feel free to get in contact if you want them. Now I'll answer, I know some people have put a couple of questions in the chat during that. And then I'll answer any questions you guys have. So just feel free to put anything in and I will answer as many questions as possible. If people are done for the day, you're very welcome to leave. Thank you very much for coming and I wish you the best of luck for the rest of your UCAT prep. how much time should you spend per question? So for situational judgment, you have about 40 seconds a question, although you have to remember that obviously the first question, you're going to have to read through the whole situation. Then the second one, you're not going to have to read it again. So it's not a flat 40 seconds per question. The way I would do it, because they come in groups of four, is I would just give myself what's 40 seconds times four. It's 2 minutes 40. I just have a rough idea that I've got 2.5 minutes per situation, and then that's quite a good way of managing it. Is UCAT paper based or computer based in 2024? It's computer based, so it's going to be on a computer. Unless there's some information I don't know. But the last few years it's been entirely on computers, and I think it will be exactly the same this year. So you do it in a computer test center normally. Thank you, no problem. Are there official UCAT definitions of what each of the appropriateness options means exactly? Not really. They haven't given like a perfect, this is what that means. So I think you just read into it how you want to read into it. The very appropriate should deal with most of the issues in the question, should be a really good response. Appropriate but not ideal should be, okay, you've dealt with part of it, but there are things that could be better in that response. It's maybe not the best way of dealing with what you've dealt with. Inappropriate but not awful, okay, it's not very good, but it's not going to cause someone harm. And very inappropriate is, no, you really shouldn't do that. Those are the options that you kind of look at and you go, God, if someone did that, that would genuinely be quite bad. A couple of thank yous. No worries, guys. I hope you all enjoyed. How many hours would you say to spend revising for each section in a 6 week period? God. So I think there's a balance to it, and I can't give you an exact answer. I feel terrible doing this because I never have exact answers for people, but I can tell you a bit about how to approach that. So I think there's two things that you're thinking about. Is first, I need to work on my weaknesses and make sure that any section I'm struggling in, any bits that I'm finding difficult, um, I can improve on those. So finding question types that you struggle with, just go and do 10 of that question type in a row, untimed, and just work it out. So working on weaknesses is a really great thing to do. But the other side of it is you want to be working on strengths because I knew, for example, in my UCAT that I was rubbish at abstract reasoning. If you ever see me teaching abstract reasoning, no, it's not my choice because I don't like teaching it. I'm not that good at it. So what I did was I got the other sections up. My verbal and my decision making I felt were good. My quantitative was good. I worked really hard to push those scores to the highest possible so that they would cover my weakness. And that was a really helpful thing. Now, I can't tell you exactly how to revise. I can say for a 6 week period, I think a really helpful thing is to try and do something every day. If you can sit and do, an hour every day, not every day, obviously you'll have days off, but roughly an hour to an hour and a half every day for the first 2 weeks, then maybe 2 hours a day for the middle 2 weeks, then maybe 3.5 hours, but not every day for the last 2 weeks, because that's when you're going to be doing mocks. So you want some intensive days where you're doing a mock and analyzing it, but then some days where you're then, maybe you do a mock and analyze it. Then the next day you're going back through, oh, I struggled on my situational judgment there. Maybe I'll go and do some more practice questions of that. Oh, in verbal, I struggled with my true false can't tell ones. Maybe I'll go and do some of those. So kind of having that split of I'll do a mock, then I'll work on whatever I need to work on off of it. You play it by ear. I always say to people, I don't want you, if you're year 12 going into the year 13, or even if you've done year 13 and you're reapplying, it's a brutal process and you don't want to be putting yourself in harm's way by doing too much. So give yourself some time off, give yourself some fun breaks. But you can kind of play it by ear of how's it going? Do I feel like I have enough time to do the things that I need to do? Am I working on my weaknesses? Am I working on my strengths? Yeah, that's my kind of answer for how many hours to spend revising for each section. It's really dependent on what you find difficult and what you feel you need to work on. Naomi's asked, would you be able to listen to music in the real exam, but only in practice? Only in practice. They'll never let you listen to music in the real exam. They maybe would if you have certain circumstance, but I've never heard of it. I don't think they would. I did it as a practice thing. I would also say for the other four sections, I wouldn't listen to music at all because they require so much of your attention to do well on. Listening to music is going to, even if it distracts 10% of your brain, that's too much. Whereas SJT is when you can relax a little bit. I used to have it as a bit of a reward for finishing a paper. So that's my kind of thoughts on listening to music. Would you recommend going through the GMC texts and making notes before doing practice questions? Yeah, you can make notes if you find that would be something that's really helpful for you. But obviously, reading these texts can be a bit dry. So we do them in the masterclass and in tuition. We can explain them to you in ways that maybe are a little bit easier and less grueling. You can go through them and make notes if you feel that would be a really helpful thing. And it might well be worth doing as well because you're going to have interviews. Um, but I wouldn't say you need to make notes. You can just read it, and that can be enough because you'll be reminded of the ethical principles as you do SJT practice. A lot of the question banks will explain answers to you. So it's not necessarily that my only understanding of the ethics and stuff is going to come from the GMC guidance. That's going to be a really helpful foundation. But then so is whenever I do a practice question. If I analyze the questions I've done and I go back through them, that's also going to teach me more about ethics. Uh, Thank you so much. I found this very helpful. Brilliant. I'm glad you found it helpful. I hope this has been appropriate to what you guys wanted. How do they decide the bands for SJT? Oh, I don't know. I can show you the numbers. I think normally about 20% get band one, about 30% get band two, about 30% get band three, and then like 10-15% get band four. That's generally how they do it. I don't know if it's like there's an answer, there's a cutoff of you need this many right, or if they do it on a grading curve. But yeah, that's the general principle of how they do it. Um, Thank you very much. Probably has been very informative and useful. Ah, brilliant. I'm so glad it's been helpful. Um, what is the UCAT score to get into band two or one? I don't know exactly what it will be. It changes depending on the difficulty of the questions and depending on the year. So they won't tell you exactly what it's going to be going into it. It must be because they can't grade it on a curve because you get your score straight away. So it must be that there's a score cutoff they go for. I don't know exactly what the score cutoffs are. Um, but I would say that a lot of the question banks, while I've said that they're not great with partial marks, in general they're fairly all right in terms of giving you an idea of what band you would get for it. So just do some of the question bank questions, and that should hopefully give you an idea of what band you're achieving. What's a good score typically? Again, I really don't know. Yeah, I just don't know how many marks you need to get the marks. Ugh, I'm talking nonsense. I don't know exactly what a good score is, but the question banks will show you. So they'll either give you a band, which is really helpful because you can say, okay, band one, band two. That's generally what you're aiming for. I'd say band one, band two, the difference is not massive. Some unis will care, but most won't. Band two to band three, okay, that will be a good difference maker. Some unis can be a bit funny about band three, but band three plus versus band four is going to be a big difference. Or the other question banks will show you where you rank according to everyone that's done this set of questions. And that can be helpful because you can just take the percentages from last year of what proportion of people achieved band one. If it's 25%, okay, am I in the top 25% of people who've taken this? Great, I'm in band one. That's how you can kind of quantify it. How many full mocks would you say we should do? Loads, do loads. Oh, I can give you some helpful advice about full mocks as well. I always discuss this with tuition students. So full mocks, you've got some great stuff for full mocks on the different question banks. That's going to be super helpful, and you can do them. I would start. I would do a full mock reasonably early so that you have a baseline because that's a really nice thing to have as okay, I'm improving compared to that first full mock I did. So do a full mock early. Then the last 3 or 4 weeks, you want to be doing full mocks, maybe one or two a week in the last in so if it's your last 4 weeks, one or two a week for the first 2 weeks of it, and then 3 or 4 a week for the second 2 weeks. I would ideally say 8 to 12 full mocks. I know that sounds like a lot. Obviously, you can get away with less, but make sure you're analyzing them really well. I think you don't want to go too hard. If you're doing a full mock every day, you're doing it wrong because you want to be going back through them, analyzing them on the day, and then the next day you want to be working on whatever came up out of it. So you kind of play it like that. Then the other thing is, so your question bank ones, I think most people end up using Medify. So Medify full mocks, great, but also do the UCAT question bank mocks. I think they're slightly harder, so they can be a really helpful one towards the end of your prep because we teach loads of strategy in these sessions in the masterclass. Can you do your strategy when you feel like things aren't going amazingly? That's a really big test because you might get nervous, you might get a little bit down on it. It's if the first section doesn't go well, is that going to knock you in the second? So do those harder mocks as well. Know that your score might be slightly worse because they're harder, but make sure you're sticking to what you know how to do in your timing strategies, even when things are tough. That's the use of those UCAT ones. I think they're brilliant. Do you get your grade or score straight away? Yes, you do. They print it on a piece of paper as you leave and hand it to you. I was too nervous, so I had to read mine in the stairwell. I also didn't want to like freak out in front of a waiting room full of people about to take it. So yeah, you get it straight away, which is terrifying. Would you say there's such things, too much practice or reaching a peak of performance and then going down from there, or is that a myth? It can be, it can be. I don't think that's what it is, though. I don't think that's people that have hit a peak and then plateaued or gone down. I don't think that's people that's over practiced in terms of, oh, you've done too much UCAT practice. I think that's people who haven't managed their well-being alongside it because it's a really intensive thing, and the temptation is to go, all right, I'm going to put in 8 hour days every day in my summer half term, in my summer break. And actually, you're not going to feel great doing that. Make sure that the time you spend practicing is valuable. When I sit down, I'm not going on my phone and doing loads of other things. I'm doing valuable practice, but then get up from your desk and go and do something. I would always recommend if you're someone that gets up in the morning, do it at like 10 to 12 is your UCAT time. Or if you're someone that gets up mid morning like me, I would recommend doing maybe like 1 till 3 and just have a time that you try and do UCAT every day and then go and enjoy the rest of your day. Um, because I think people that peak or do that, that tends to be people who are just feeling a bit burnt out. They've done their year 12 stuff and then they've done all this UCAT practice and they're just tired and nervous and stressed. So that's my approach to it is I think you have to be really conscious of trying to manage yourself, giving yourself the occasional day off as well to go and do something fun. I'd say that's how you avoid that. Yeah, because I feel really bad for. I remember doing it, and it was horrible, and I feel bad for everyone that I meet as students. I think you guys have it really tough with the amount of stuff that you guys are having to do. So make sure that you're managing that. Okay, I think that's all the questions. So we will leave it there for today. Thank you very much for coming, guys. It's been great teaching you all, and I will see you next time if we do any more teaching, or I'll see you in a masterclass or a tuition session or something. Okay, bye, guys.